Hello friends, discussing another topic, necrosis, which is an important topic from your NEET PG. What is basically necrosis? Necrosis is the spectrum of morphological changes that follows the cell death in a living tissue. In a simple word, it is known as the cell death, and it is due to the degradative action of the enzymes on the lethally injured cells. This necrosis is divided into the 5 types based upon the etiology and the morphological changes. All these have been asked time and again for your NEET PG examination. Coming to the first type of necrosis, that is the coagulative necrosis. Coagulative necrosis is the most common type of necrosis and which is seen due to the ischemia, that is decrease in the blood supply, which leads to the hypoxia. And this hypoxia causes the denaturation of the intracellular proteins. This is seen due to ischemia in solid organs like the heart, where it leads to the development of myocardial infarction. It is seen in the another solid organ, that is spleen. Also, it is seen in the kidney. Remember, all the solid organs undergo coagulative necrosis except brain, where you see the liquefactive necrosis, which I will be discussing. Coagulative necrosis is also seen in mild burns or the thermal injury. It is also seen in Zenker's degeneration of the muscle, seen in the typhoid, and it is seen in the rectus abdominis muscle. The dry gangrene, which is seen in the diabetes, it is also considered as a variant of the coagulative necrosis. Grossly, what happens in the coagulative necrosis, that the tissue architecture is preserved. You can see over here that this is which organ? That is spleen. And what you see over here, there are numerous white areas which are wedge shaped. So these are the areas of the coagulative necrosis which are wedge shaped, and on the apex of the wedge you have the vessel which was occluded due to leading to ischemia, and the base is formed by the capsule of the organ. Clear? On microscopy also you can appreciate that the tissue architecture is preserved. Like you see, which is this organ? Yes, you can see a nice glomerulus. So this is a kidney. You can see that this is a normal kidney, and this part is the necrosed kidney. Over here you can see that the outlines of the cells are maintained. There are no nuclei, but again the outlines are maintained. This appearance is known as the ghost cells or the tombstone appearance. This appearance is very classical of the coagulative necrosis. Clear about coagulative necrosis? Moving on, we have the second type of necrosis which is seen, that is the liquefactive necrosis. It is due to the enzymatic digestion of the cells. This is seen most commonly in the infection where the tissue is converted into the liquefied thing, that is abscess. As the name suggests, in this what happens, there is a liquefaction, that is the tissue is liquefied due to the enzymatic digestion of the cells. It is also seen in ischemic necrosis of the brain. You see over here that this is a normal brain, but over here you cannot make out the brain because all this have been digested because of the enzymes, and there is a liquefaction which was removed while processing. Moving ahead, we have the third type of necrosis, that is the caseous necrosis. This is intermediate between the coagulative and liquefactive necrosis. This is called caseous because in this the tissue becomes the cheese-like, that is it becomes yellowish and friable. In this, the tissue architecture is completely lost. You can see over here the cheese-like appearance of the lung. This caseous necrosis is seen with certain organisms like Mycobacterium, that is Mycobacterium tuberculosis, and in fact this is the commonest cause of the caseous necrosis. It can also be seen in infection with the syphilis and also in the fungal infection, especially the histoplasma and the coccidiomycosis. How does it look? In this, the tissue architecture, as I told you, is completely destroyed. This is, you can see this pinkish amorphous material. This is the caseous necrosis. And this caseous necrosis usually is seen in the center of a thing which is known as the granuloma, which I have shown you. This granuloma is composed of this epithelioid cells which are seen here and few giant cells which are highlighted over here and surrounded by the lymphocytes. So this is a granuloma where you see the caseous necrosis in the center. This is very characteristic of infection with the Mycobacterium tuberculosis. In fact, when you see caseous necrosis in India, we always think of the Mycobacterium tuberculosis. Clear? Now, there is another type of necrosis, that is the fat necrosis. This is of two types, enzymatic and non-enzymatic. Enzymatic is seen most commonly due to the action of enzyme lipase. This is the lipase enzyme is there in the pancreas. So it is seen in acute pancreatitis. When the pancreas is inflamed, this lipase escapes and it causes the necrosis of fat adjacent to the pancreas, that is retroperitoneal fat and the omentum. And how does it look grossly? What happens? The enzymatic digestion of fat liberates the free fatty acids which combine with calcium to form soap. And this soap appear as this chalky white deposits, which you can see over here. This is the fat and these are the chalky white deposits seen in the fat necrosis. The second type of fat necrosis is traumatic or non-enzymatic, seen due to trauma. It is seen in tissues which are rich in fat like the breast, thigh and abdomen. Clear? The last type of necrosis is the fibrinoid necrosis. This is so called because in this you get the deposition of pink colored material which is fibrin-like. So hence it is called fibrinoid. This fibrinoid thing is formed by the deposition of the antigen plus antibody complexes which give rise to this pink color. This is seen in diseases like malignant hypertension where you see in blood vessel. This is the most common cause of the fibrinoid necrosis. Also it is seen in the polyarthritis nodosa, acute rheumatic fever, systemic lupus erythematosus and Henoch-Schwann purpura. In all of this, you see this pinkish material deposited in the blood vessel, that is fibrinoid necrosis. So these are the 5 types of necrosis which we see. Hope you are benefited from this video. Please subscribe to me and follow me on the YouTube.